So today I'll be talking about polynucleotide aftercare. Now, polynucleotides are an injectable treatment that are part of regenerative medicine, mainly used around the face and around the eyes especially. So with this treatment, usually it's going to be done using either a needle or a cannula. If it's a needle, straight after the treatment, you'll probably observe lots of little dots, usually under and around the eyes, which is the primary focus area of the treatment. To begin with, it can look a little bit strange because any treatment within the layer of the skin, you see it straight away. So when you're looking at the skin, you could be thinking, oh my god, what's going on here? It looks quite unusual, but that commonly settles within a day or two because these little dots within the skin settle really quickly. If it's done with a cannula, which is a long thin tube that isn't sharp, again we can do that in areas under the eye and within the mid-face and the smile lines in these areas. The immediate little dots that you see won't quite be there, so actually straight away it doesn't look as bad. So that type of technique might minimize the initial little dots that you might see, but each practitioner typically does it differently. With regards to aftercare, whenever we use a needle or a cannula and whenever we go through the skin, there's always a small risk of a local infection. It's still good practice to make sure you don't put any creams on, don't put any makeup on, don't touch the area, don't rub the area, keep it nice and clean for the first 4 hours or so. Over the first week, it's good to try and minimize sun exposure for the first week or two really, and be quite fastidious with your sun protection. This is because direct sunlight can trigger more inflammation and it can delay the healing process a little bit whenever you get any type of injectable treatment like polynucleotides. Other things to avoid for the first day or two would be any intense exercise. But again, compared to dermal fillers, the aftercare is not quite as stringent with this treatment as other treatments. Other things to avoid would be no injectable treatments such as Botox or dermal fillers for 1 to 2 weeks. Avoid any energy-based devices or any treatments that stimulate collagen. Avoid anything like that or lasers for about 3 weeks or so, but your practitioner should be able to talk you through the right timelines of when you can do what sort of treatment with polynucleotides. Generally speaking, this is a treatment that settles pretty quickly. If you're finding yourself in a position where you've got redness, itching, it's hurting more than you'd expect, or anything unusual going on beyond 2 days, it's probably good to get in contact with your practitioner, but generally speaking, 99% of the signs and symptoms that you'd have of any issues will settle down within about 2 days. Lastly, with this type of treatment, because it is DNA level change, it's going to be less of a dramatic immediate result that you're going to see straight away, straight after the treatment, but give it time. With these treatments, they're meant to be done over a course of about 3 or 4 treatments about a month apart, and with each one the treatment's going to get better and better and better. The evidence base for the impact this treatment has on your collagen, your skin quality is absolutely huge, and it's a wonderful treatment. I hope you found that useful. If you've got any questions about polynucleotides, please do either email them to us or drop them in a comment here. We'll be happy to get back to you. Thank you very much.